Call Barbara Kuriga.
Mr Speaker, it's a pleasure to be here tonight taking a call on the Health Protection Amendment Bill. It's particularly pleasing because this is this is the first bill that I've actually started as a new Member of Parliament from the beginning and following it the way through the process, so it's always going to be particularly relevant to me. It's clear that some parts of the legislation from over 50 years ago need updating in order to improve to modern times. And if I think back, 50 years ago, a lot of infectious diseases and things were actually quite isolated within communities because people actually didn't travel as far as what we do now. And so when you think about the progress in travel and the way people shift around communities in the last 50 years, the risk has become much, much greater than it ever was in the past. And it's also the science that we've developed over time and the thought development and also the tracking systems that we had. When everything was manual 50 years ago, there was not the ability to be able to do some of the things we do now. So the Health Protection Amendment Bill aims to amend and update the Health Act 1956 and it also seeks to update the legislation around sunbeds. And so if I think back, I can't remember any of our parents or any of our brothers or sisters or people back many, many years ago actually having a fetish for sunbeds. I think people are now starting to learn the lessons of those, and we are starting to become aware of the harm that they are capable of causing. So good health is of crucial importance to New Zealanders, young and old. And this national government has an unwavering focus over the past 7 years with respect to maintaining and improving our public health services. And New Zealanders are receiving more, better, convenient health care, and it remains one of the government's priorities. And during this bill, we heard over 70 submissions coming in, and I was really, really impressed to see the diligence that people applied when they were presenting their submissions. And the other thing that I was really impressed with over the course of sitting and listening to those submissions is the way that different groups in the community who are working together to strive to make things better in the health sector are actually coming together and working on joint submissions to make their cases stronger. So I was very, very impressed with that, and they did bring a lot of concerns to us, and I also would like to commend the officials who were in the room, because as you can imagine, tracking a whole range of infectious diseases and contact tracing is actually quite a large thing to do, and so we were always able to test and measure back with those officials for things saying, is this possible, can we do it, the things that these people are asking for, is it possible to do that with your system, and the reassurance that they gave us that it was possible certainly helped us to make our decisions. So the provisions in this Act are multiple, and they primarily allow for the tracing of people who have infectious diseases and introducing a ban on the provision of commercial UV tanning services to those individuals under 18. And I have to say that this is the area where I feel that, those people need to be protected more than other areas. People who are under 18 haven't actually had the opportunity to read as widely as older people, and, they still are very much minors. They're not old enough to vote, and they need to be protected in that sense of the word. But I also want to make a comment before we heard about how we have, pubs letting people in who are 18, and, people won't respect it. Well, to be honest, pubs will only do that until somebody actually catches up with them, until somebody actually realises that they're selling alcohol to a minor. And I believe that the regulations around this are going to ensure that these places are tested and measured and audited in order to make sure that they're not breaching the legislation. I also think it's really important that they do, whatever age of people they're dealing with, that they do have respect for the legislation, because we know so much more now about the dangers about how sunbeds are used, and I think it's really important that the usage of them is much more under control, because unfortunately this is an industry where it's largely been ignored, and the more you ignore the regulations, the more you open people up to health risk, and the more you find that they are susceptible for getting melanomas from sunbeds. I too have to say that I'm impressed with the overall cross-party support that was shown in the Health Select Committee. It's certainly rewarding to New Zealanders when we are able to work together to achieve great results. And I think the Health Select Committee is definitely a pleasurable place to go, and I give credit to all the members of the team, and I have to say that it's also reflective of our chair, Simon O'Connor, who does a great job in chairing the committee. So since the first act, in 1956, as I've said before, the knowledge, the scientific development have put forward strong evidence in a lot of these areas, and it was great to see that evidence coming in and having people talking to us, and I'm very pleased with the outcomes that we're putting forward this evening in the House. So on balance, the evidence, I know we've heard a bit about whether we should widen the scope of sunbed, but I think the evidence of health harm gives sufficient justification for intervention, particularly around those people who are under 18. The measures in this legislation largely, other than that, provide for better tools for public health. So we have a better opportunity for staff to deal with infectious diseases, especially when people do not offer to seek voluntary treatment. And so if somebody's not actually coming in and presenting with the disease and obviously, offering voluntarily to behave in a best practice way around this, then it gives the officials a chance to do something about it. So it places a duty on the medical practitioner who's in charge to provide information to officials who are in charge if there are measures needed to prevent the further spread of disease. And I think, this is such an important thing, that the cooperation between the health officials and the public means a safer environment for all New Zealanders. And I want to say that we did have quite a bit of discussion, and we did have some people coming into the Select Committee who were rather concerned about privacy issues around that. But, the Act has provisions in it that make sure that everybody's privacy is absolutely protected. However, there's always a balance and there's always a judgment, and I think we are reaching that right judgment where there's a balance between the person's own private privacy issues and protecting the public as a whole, and so that you don't get to the point where actually, you're actually keeping someone's privacy so quiet that the rest of the public are exposed to a huge risk. So, Mr. Speaker, it's a pleasure here tonight to be supporting this second reading of the bill to improve the tracing of people, to increase the range of infectious diseases that are notifiable. And I think it also provides a series of incremental options for the management of individuals with significant diseases whose behaviours do put others at risk of contracting a disease. And so a number of changes that will streamline legislation. That's inclusion of tuberculosis as a notifiable disease under the Act, and the consequent repeal of the 1948 Act. So that's an Act that goes back quite a way in time. So, Mr. Speaker, it's my pleasure tonight to commend this second reading of the bill to the House. Thank you.
Mr. Speaker.
I call Ian Lees-Galloway.
Thank you very much, Mr. Speaker.